And thank you, Minister. I'd like to commend Deputy John Browne for bringing forward this very important bill on behalf of Fianna Fáil, which is introducing this bill to help reform the HSE's current reimbursement process, to help provide a better situation for assessing orphan drugs. Approximately 1 in 12 people will develop a rare disease, and orphan drugs are currently assessed through the same mechanism as all pharmaceutical products, but the odds are completely stacked against them. Because the numbers affected are so small, the medicines are usually very costly and their price often exceeds the criteria set out by the NCPE and the HSE. While these drugs are very costly to develop, and the low patient population and the low success rate in bringing the drugs to market can make it very difficult to assess based on clinical data, and effectively these drugs are very often set up to fail in the current system. And these are drugs such as Kuvan, Translarna, Reprisa, Orkambi, Spinraza, and an ever-growing list of drugs. And what these families and their children want is they want hope and they want a fair chance. And I do want to focus on a particular drug of Translarna for Duchenne muscular dystrophy, which affects approximately 12 people in the country. But the drug that's available, Translarna, is only usable for children of a certain age. So there's only, it falls into about 5 children falling into that category. And those families have been up here as well, outside the gates of the Dáil, and have presented in the AV room on a number of occasions, so they are. And muscular dystrophy, I mean, it's a debilitating genetic disease that eventually leads to these children's death. Unfortunately, their muscles effectively waste away. Eventually, they lose the capacity to breathe, and eventually their heart gives out. And Translarna is the first licensed therapy that addresses the underlying cause of this disease. It's available in 22 countries across Europe, and it's not available here. It works, it saves lives, and there are no alternatives. And for those distraught families and their sons, I mean, they are against the clock. They know if they don't get this drug by a certain age, it is simply too late. Now, I know many of the pharmaceutical companies effectively run a blackmail system. They pit countries against each other. But nonetheless, what we can do is put in better processes in this country to effectively provide a proper system so these drugs, orphan drugs, can be fairly assessed. And that's the thing with it. And that's the thing that I think is most distressful for these families. They see a very opaque system. They see a system that has no transparency to it. There's no dates for meetings. There's no dates or information as to what is happening, how some drugs are or not being approved. There's no information. They don't know. They need hope and they need these drugs, so they do, Minister, very desperately. And something we're probably not much time to touch on as well tonight, but it's just a waiting list for genetic services just to get children assessed and diagnosed with their relevant diseases. And I mean, these are genetics. There's nothing these children can do about these. But I mean, even if you take the cancer drugs, 20% of new cancer medicines launched internationally in 2015-16 were made available in Ireland, 76% in Germany, 71% in Austria and 67% in Denmark. And patients groups are simply saying that Ireland is an outlier. So, Minister, I am asking you to support Deputy Browne's and Fianna Fáil's bill. I think it's a very good bill. It sets up a way for a proper and fair reimbursement process and to help these families have hope for their children.